Longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, my Florida neighbors, and look what's happening. I hope you're all getting your COVID shots and you're all up to date, especially you seniors. Make sure you get your shots, please, and make sure you do the social distancing and still wear your mask. Tonight we have a great show. We have a great young doctor, Dr. Zena Menezhoff. He's with the Boca Raton Orthopedic Group. Doc's with me right here. I'm going to let him tell you. Doc, tell us a little bit about yourself. Tell us where you went to school. What's your type of practice? You have a very unique practice. This is a young doctor that doesn't believe in it, but he really tries to avoid surgery as much as he possibly can. Most of his stuff is all therapeutic. Doc, why don't you take over and tell us a little bit about what you do and how you do it?
Sure. Thanks for having me on your show tonight. So I'm a osteopathic physician. I started my medical school training in New York. Went to New York College of Osteopathic Medicine. Graduated in 2010. Afterwards, I continued to do a residency in physical medicine rehabilitation. Most people haven't heard of that, also known as a physiatrist. Basically, we focus on healing people, getting them back to their life standards, and my focus throughout residency was trying to help people in pain. I worked at the VA for about a year and a half and treated a lot of the veterans. Most of them did have chronic pain, anywhere in the spine, low back, hips, knees. I also treated migraines with Botox. And also throughout my residency, we did focus on interventional pain care, which included injections into the spine. I continued that with a year fellowship down in Nova Southeastern, and that was more focused on a spinal interventional care, which included epidurals, facet injections, kyphoplasties, radiofrequency ablations, and much more than that.
Well, a lot of people know about the epidurals and stuff. I had a couple of myself. What's kyphoplasty? What is that basically?
Kyphoplasty is basically if there's a compression fracture in the lumbar spine, mostly lumbar and thoracic. Basically, it's a fracture in the vertebra, and that could cause pain. It's diagnosed on X-ray and MRI, and if it's painful, we put some cement in there through a small cannula.
Now, this practice that you're practicing right now, which is basically what you said, physiatry. A lot of people don't know what physiatry is.
No.
Physiatrists now, I understand, they usually deal with elderly patients, don't they? Pain medication, it's sort of...
It's a big spectrum of the types of people we treat. A lot of it could be inpatient. Inpatient care is basically patients who are post-operatively being treated for, hip and knee replacements. Also treat traumatic brain injuries, spinal cord injuries. In an acute setting is a little bit different than an outpatient setting. So in an acute inpatient setting, patients are coming in usually post-trauma. So a lot of my residency was dedicated to that. I treated a lot of hip and knee replacements post-op coming into the facility. Trying to get them back on their feet. They're usually very weak, so we worked on that. Then we have a lot of spinal cord injury patients. They come in with weakness. We try to help them, rehab them to get, again, back on their feet. And as an outpatient, a lot of that is, as a physiatry outpatient physician, you are more looking into pain management aspect. Again, trying to get the patients not go onto the surgery table. Focus on physical. A lot of what I do is focus on physical therapy. I almost recommend 80 to 90% of my patients to physical therapy, so they can get better using their own body strength.
You know, we had there was a hospital, I think it's the Del Rey. That's a post-acute hospital, I think it is. Pinecrest?
Sure, yes.
You familiar with Pinecrest?
Sure.
Now, Pinecrest, I'm sure you take care of a lot of stroke victims too, correct?
Exactly.
Stroke victims?
Exactly.
Between stroke and those people that are quadriplegic, paraplegics
Correct.
today, which is a major problem, they're always in pain.
Right.
So some of the things what you do is you basically, without surgery, because it's either post-operative, you're going in there after the surgery is done and trying to, let's say, try to hit the home run and get them better.
Exactly.
Okay. Now, with the opioid, a lot of people get hooked on opioids. You know, with this Oxycontin.
Right.
I remember having a gentleman working for me. He had back pain, and he started with Oxycontin.
Right.
And before you know it, he lost his family, he lost everything, he got hooked with these opioids. So you're not pushing that type of medication, am I correct?
Very few, very limited patients receive opiates on a long-term basis. If someone is coming in with acute injury and he or she is in severe pain at the point, I do give them a few days supply. But nobody, unless you're in severe pain due to a chronic issue, then you're not getting much opioids from me.
What he's saying, you're not going to go there as a pill factory and say, give me a prescription for 100 pills. He's not doing that. He's a typical physician that says, I'm going to heal you the way I think I should be healed. Am I correct?
Sure.
And you're not going to dictate to him what you need for opioids.
No.
So some of the other things you do, you went to osteopathic medicine in this PMR residency in Stony Brook. Is that correct?
Like physical medicine rehabilitation.
Physical medicine. Physical medicine is what? What is physical medicine?
Physical medicine basically means trying to, work on the patient as a whole unit and not, so focusing on musculoskeletal medicine.
Okay, so it's basically the patient's trying to heal himself.
Correct.
It either can be mental, physical,
Sure.
some it can be psychosomatic injuries, correct?
Sure.
So you're looking into the whole patient's needs and whatever he needs to be done.
Exactly.
Well, let me ask another question. You're working with a number of physicians who I happen to know with both the orthopedic group, and if you find that the patient needs something more, you can always refer him out, correct?
Yeah, I work with a fantastic group of doctors. We have all types of surgeons in our facility. So we have hip and knee specialists, two foot and ankle orthopedic surgeons,
Hand specialists.
hand specialists, highly trained doctors. I think a couple of them are IV grads. So a lot of the patients, I would say 90% of our patients do not end up in surgery.
So what he's working with, he's got a. When I was talking to the other physicians, they told me they were going to bring in doctor. It sort of rounds off their whole practice. He's the individual that says, okay, you're going to get a surgery. I'm going to follow you up after the surgery.
Correct.
I'm going to make sure that you get your rehab done properly. Which is very important. I know I'm suffering from two basic, I guess, meniscus tears, and I asked the doctor what can be done. And, there's a number of things you can do even with meniscus tears or with knee surgery with rehabilitation. So he pushes rehabilitation. He doesn't put so much surgery. If surgery has to be required, he'll refer you to the right person, I'm sure, won't you, Doc?
Sure. I also do a lot of interventional care for the spine before, in conjunction with physical therapy. So if somebody comes in with disc herniation in the neck, so some disc herniations cause pain just in the neck, and some disc herniations will cause pain with pressing on a nerve root going down the arm. So a lot of patients will come in, we'll start them off with some physical therapy and some oral medication. I'll start them off with anti-inflammatory, muscle relaxants in conjunction with physical therapy and see, give them a couple of weeks. If that doesn't work, I'll bring them back in, have it do an MRI, and see the extent of, the disc herniation. A lot of them, they get better with 1 or 2 epidural injections. If that doesn't get better, tell them go on for physical therapy a couple more months. And if that doesn't get better eventually, and they're in severe pain, I do refer them to Dr. Munoz, our spine surgeon, and they could discuss further evaluation, possible surgery.
Now, I play golf, and a lot of my friends who play golf, I just referred a gentleman, he ended up with a sacroiliac pain that he couldn't get rid of, and it was very painful. Now, do you treat the sacroiliac too?
Sure.
That's a common.
It's very underdiagnosed. I'd say one of the most underdiagnosed pain symptoms that I see. So because a lot of the pain just mimics sciatica. So patient comes in, they all think it's sciatica, but after exam, I tell them no, it's not really sciatica. It's really a pain coming from your outside of your pelvis bones, sacroiliac joint, and it's pretty easy to treat. Usually 1 or 2 injections, and they're usually doing much better. So sometimes if it doesn't get better, I could also do a radiofrequency ablation. That basically blocks the nerves innervating the joint in a much longer term. The procedure is done where you come onto on our fluoro suite, we lay you on the bed. It seems like similar to most other injections, but this time we do desensitize the nerve endings with a heating probe.
Mm-hmm.
And that could last you much longer than a general, corticosteroid injection.
That's almost like cauterizing it.
Cauterizing, exactly.
Right? Just like if you have a nosebleed, they cauterize your nose.
Exactly.
Right? So that's what he does. So as you can see, most of what he's doing right now is all what I call medicine that heals yourself. He's working with you so you don't have to go through that painful surgery that you don't want to go through. And that's, everybody tries to avoid surgery, I'm sure. So he's the guy that you want to go see when you have a hip. What's a hip pointer? I just talking to a gentleman now. He said he had a hip pointer.
I think a hip pointer refers to a trochanteric.
But his hip, he said he thought it was his hip pain, and the doctor said if it doesn't go here, it's a hip pointer.
I think he's referring to a trochanteric bursa, possibly.
Yeah. So they gave him a couple of injections. It still hasn't healed too much. So I might get him to come and see you.
Awesome.
Right?
Thank you.
So anyway, we're going to go for a short break right now. 60-second break, and we'll come back right with you quickly. Thanks, folks. We'll be right back.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do. Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
All County Healthcare. All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. And Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, folks. We're here with Dr. Sina Mezanoff. And Dr. Mezanoff is with the Boca Raton Orthopedic Group, 660 Glades Road. I think that's right across the street from FAU, Doc?
Sure.
Right across the street from FAU. They're at the Sandler Medical Plaza, Suite 460 in Boca Raton. And their phone number, you can reach Doctor at any time at his phone number, 561-391-5515. That's 391-5515. They also have an office on Jog Road in Boynton Beach. So if you're Boynton Beach residents, you don't have to travel too far. He's at Jog Road. And for the Boca Raton and Delray people, he's in Boca Raton. That number again is, we want to give it again, 561-391-5515. Doc, I'm going to ask you a few questions about some of the procedures you do.
Sure.
And a lot of people don't know what these procedures are, so maybe you can help explain it to them. What's an epidural injection?
Okay, so epidural injection is basically putting in medication close to the disc that is herniated and painful, as well as blocking a nerve that is coming out of the spine that is inflamed. A lot of people are very they're not sure exactly what an injection, they hear cortisone injection, they think all cortisone injections are the same. The medication is the same. Most of the medication that we use is the same. But more importantly is where you put the medication. So some people come in with low back pain. They require a facet injection, not a epidural injection. A facet injection is slightly different than an epidural injection. The facet joints are, they run all throughout the spine, all the way from the cervical spine, which just starts beneath your occiput and goes all the way down to your sacrum. So each vertebra is connected to the next vertebra through the facet joints. These facet joints do get very inflamed, usually in the geriatric population. They get a lot of arthritis. And what happens is that patients always think that they're having pain coming from a disc. In the geriatric population, a lot of the pain is coming from the facet joints.
Facet. That's a facet joint injection you give.
Yes.
So the epidural is a facet. Then you have another thing called, I don't know how to pronounce it, Kyphoplasty?
The Kyphoplasty, we spoke about how you put cement into the fractured vertebra.
Okay, is that like, that's not similar to when they give you the injection for your knees? There's a series of 3 injections or 5?
No, it's different. This is just putting, to stabilize the vertebra that's fractured. Basically what we do is, it's a minimally invasive procedure. We don't even, a lot of the patients are not even, we don't even use sedation for them. We put them on a bed, take a few x-rays, and with an x-ray guidance, we put the cement through the vertebral body and expand that compressed.
Why couldn't that be done for knees? I mean, it's maybe a crazy question, but I'm just asking. It sounds like it could be done for knees too?
No,
No.
I can't.
It shows I'm not a doctor. It shows you it's right at the doctor here. Now you got the spinal stimulator trials.
Correct. So spinal stimulator trials are FDA approved for multiple things, including post-surgery, laminectomy syndrome, and CRPS, which is also known as complex regional pain syndrome. It's been around for many years, but it has really evolved over the past few years. There are multiple companies that have really high science behind what they create. So basically what it does is, I'm not an expert into the, on the molecular level, but from the way I was taught and understood this, is that it blocks the pain going into your brain. So if you have low back pain that's been chronic, you haven't had any you have tried the injections and have failed those, the stimulator is placed into the epidural space, and it blocks the nerve, it blocks the pain with different electrical signals from going to your brain.
That's not like a TEMS unit.
I would say it's a TENS unit into your epidural space, but it's much more than that.
Okay.
It's much more
scientific.
Much more scientific than that.
And then you have peripheral joint injections.
Correct. So peripheral joint injections are any basic hip, knee, elbow, wrist, shoulder injections.
So those are the right what they usually give you when a guy go in for knee injection. They call that what's that injection they give you in the knee?
Steroid?
No, what is it? It's it's one shot they give you, huh? Cortisone shot.
Sure,
It's like
yes.
a cortisone shot,
Sure.
right? Okay. And the next one you got is radiofrequency ablation, RFA.
Sure. So radiofrequency ablation is basically we desensitize the nerve endings that are causing the pain. So most oftenly is done for neck and back pain that are caused by the facet joints. So if you have pain, you have arthritis in the neck, arthritis in the low back, coming from the facets. Firstly, we block the nerves that are coming from there. So it's just some lidocaine and steroids just to block the nerve. And if you get about a 50 to 60% relief, you're a good candidate for radiofrequency ablation. It's almost the same procedure. It takes about 5 minutes extra. We do all the procedures are done in our office, and with about we desensitize the nerve endings with heat. We don't use a blowtorch. It's just a cannula that has and there's an electrical probe that is heated up to about 80 degrees centigrade, and it's used for about 60 to 90 seconds. Patients have a great relief with that. It lasts about anywhere from a year to 2, and it's also being used right now to do knee pain. So
knee pain?
Yes.
Ooh.
So it's also called.
I might come and see you.
So if you have there's also nerves that supply the innervation to the knee called the genicular nerves, and I have some patients who don't want to go for the knee replacements,
That's me.
and they've failed the injections, the other types of injections, the Synvisc, the viscosupplementation, the corticosteroid injections, and then this is kind of last resort prior to going to a knee replacement. Most of the time, it's used for osteoarthritis, not so much with, tears of the meniscus.
Not so much for meniscus, just arthritis.
Most arthritis, yes.
Okay. And then, a lot of people heard about Botox.
Yes.
Right? They say, I get the Botox injection for the females. It's going to help my face, maybe look prettier, happier.
Right.
But now you're using... We got to wrap it up. That fast? Well, Doc, they're telling me I have to get off the air. We have to get off the air, but you were fantastic.
Thanks.
I'd love to have you back. Please come back. We have to get off the air. We got 1 minute. Folks, thanks again. Have a wonderful, wonderful week. Please, obey the science. Wear your mask. Get your shot. Don't be afraid of it. I got mine. And the doc highly recommends everybody get their vaccination. Am I right, Doc?
Yes.
Thanks again. Have a wonderful, wonderful evening and a wonderful, wonderful week.
Thanks for having me. Thanks for having me.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and